When presenting information about the dangers of smoking and the use of any other tobacco products to young people, a different approach is really required than presenting that same information to adults. Just like we know that we can't treat young children and teenagers like miniature adults, we have to specify some certain issues related to the initiation of tobacco use that are unique to the pediatric population. And first of all, and first and foremost, use of any tobacco products is unsafe for youth, pregnant women, and current non-smokers. So current non-smokers should never begin to use tobacco products in any form. And that's been a source of real confusion for the youth community and for their parents and teachers, because so much of the advertising, especially around e-cigarettes and vaping, has been about, are they safer than smoking? Are they a harm reduction method for adults? And while we have a lot of conflicting evidence and a lot more research needs to be done, we know that e-cigarettes for adults who are already committed smokers who are causing themselves harm, they may indeed be a valid harm reduction method and be less dangerous than continuing to smoke combustible products. But for young people who have never used a tobacco product, there is absolutely no benefit to initiating nicotine use or tobacco product use in any form. In particular, we know that first use of tobacco most often occurs in young adolescents, and the earlier use begins, the less likely quitting becomes. Research has shown that even infrequent tobacco use is associated with a greater risk of dependence, and this is because there's a critical period of brain development that begins around age 10 and goes on until the early 20s. And the use of nicotine-containing tobacco products and also any substance that has addictive potential during this time is disruptive to normal brain development. And the younger use begins, the more potential there is for disruption and the greater risk of developing nicotine dependence. And studies have also shown that young people who initiate use with nicotine at a young age are also more likely to have a higher incidence of other substance use and misuse, including underage alcohol use, marijuana use, and opioid use. So the rising use of nicotine-containing products among young people really does have implications for all of our other substance abuse prevention. Now, the trends in tobacco use that are specific to the pediatric population is starting in about 2015. We had, at that point in time, cigarette smoking and cigarette initiation down to under 10%. But starting in that time period, the popularity of e-cigarettes has driven tobacco use up to the point where, according to the 2019 National Youth Tobacco Survey, 31.2%, or almost 1 in 3 high school students currently uses a tobacco product. By far, around 28% of that total is e-cigarettes. But surprisingly, the next most common used tobacco product by young people are cigars, cigarillos, blunts, followed by cigarettes, smokeless tobacco, hookah, and pipe tobacco. There's also a number of health disparities associated with tobacco use and tobacco use by youth. Urban, suburban, higher socioeconomic groups, e-cigarette use is extremely high and very predominant. In lower socioeconomic areas and in rural areas, there's a greater use of smokeless tobacco products and cigarettes, including the new generations of smokeless tobacco products, the snus products that come in multiple flavors. They look like a little tea bag with white powder in it that you just put between your teeth and your gum, or you chew like gum and spit out like a piece of gum, and you don't have any of the nasty cosmetic spit tobacco, traditional spit tobacco, and brown juice and brown teeth. So those products are becoming more popular among young people. Also, many youth currently use flavored cigars and cigarillos. They come in an amazing variety of flavors, including grape, mint, other fruit flavors, chicken and waffles. I actually have one in my demonstration package, and they can be obtained very cheaply. In some cases, in some rural areas of Georgia that I visited recently, you could buy a pack of 4 cigarillos for 99 cents. There's also a traditionally higher risk of tobacco use in African American, Native American, Alaskan Native populations, as well as LGBTQ individuals and those with other behavioral and mental health challenges and health disorders. So when I am looking at the whole child, I look at all these other risk factors that also increase the risk that these kids are going to be more likely to use tobacco products. One of the challenges in youth cessation of tobacco products, especially vaping products, is that the FDA-approved cessation medications are not approved and indicated for under the age of 18. There is some off-label use of nicotine replacement therapy discussed by the American Academy of Pediatrics, but with the caveat that since we know that nicotine is disruptive to normal neurodevelopment, that use of a nicotine-containing product as a smoking cessation method does constitute somewhat of a risk, so there's caution there. Quit smoking and vaping modalities have been developed that have been marketed directly to youth and developed with youth in mind. Again, young people don't respond to the same types of marketing and counter-marketing and cessation marketing that adults do. Some of the modalities that are available that have had some success in helping youth quit have been truth initiatives, quit smoking and vaping tools, including Become an X, and this is quitting. The Centers for Disease Control has a variety of quit smoking messaging and modalities for every age group, including tips from former smokers. The U.S. Department of Health and Human Services has smoke-free teen and smoke-free text, and many of your state tobacco quit lines are now developing a separate line for young people that access the quit line. For instance, in the Georgia quit line, where I'm from, there is a question that asks what age you are, and the quit line is available to people 13 and up. And if it is a 13 to early young adult person, they will be put into a different line of quit support that's more specific to youth needs. In addition, we have to look at the reasons why kids initiate tobacco use. So a lot of it is misinformation. They've heard the talk about how vapes, just harmless water vapor, e-cigarettes are harmless. They come in really good flavors. Most children don't understand, and teens do not understand that they contain nicotine or the amount of nicotine in them, or that they can be habit forming. So advertising is almost universal. So advertising gets them curious. The great fruit flavors get them started, and the nicotine content easily addicts them and keeps them coming back for more. Now, one thing I do want to point out is that there was a federal flavor ban that came into effect in January of 2020. However, that flavor ban only applied to the narrow product base of the pod-based devices like Juul, that the e-cigarette liquids that you can find in vape shops are still available in every flavor. And in addition, the market has become flooded with a whole array of new products that are single-use disposable, that are not refillable with pods, and those disposable devices are not covered by the federal flavor ban and are still available in every flavor under the sun. We know that the gold standard for quitting smoking in adults is some sort of support, cognitive behavioral therapy coupled with a FDA-approved smoking cessation medication. In youth, it's important also to incorporate some type of cognitive behavioral strategies, because initiation and use of nicotine or any other substance is usually an indication of poor decision-making, poor coping strategies. We've seen an explosion both in tobacco use, vaping use, and other substance use among youth, for instance, as we have been ongoing with the COVID-19 pandemic. When people are stressed, they're more likely to use drugs and alcohol, including nicotine. And if we don't equip children with healthier coping strategies and other healthy ways of handling stress, they are going to be more likely to increase smoking and substance using behaviors. So cognitive and behavioral strategies to help develop self-monitoring and coping skills, motivational strategies to help them clarify a desire to quit and reduce mixed feelings about quitting if they're current smokers or vapors, and also refusal skills, because we can get a child through 3 weeks of nicotine withdrawal. We can give them some basic education, but how do we prevent them from picking up the habit all over again when they go back to school or go back among their friends and everybody's passing around a vape pen? And if you don't give them an opportunity to practice refusal skills, their chances of relapsing and beginning to use again is very high. Do I currently use any of the TIPS campaign resources in the community? We in our community, and one of my activities is I'm very active in our local substance use prevention nonprofit in our community. And we use a global approach. We will promote a variety of quitting methodologies so that people have an array of choices, and including the tips from the Tips from Current Smokers campaign, not really having any ability to track results on that. In my clinical practice right now, my clinical practice is with newborns. And so my smoking counseling is mostly with new mothers who use tobacco and trying to give them some of the more young adult and adult modalities for quitting and encouraging them to quit smoking and vaping, and talk about secondhand smoke and vapor. So having a variety of resources of what's available in your community would be very important for pediatric NPs and family nurse practitioners in their practices. Some of my pearls are words of wisdom for my NP colleagues for helping with smoking cessation. And I'm going to focus my comments here more on the pediatric and adolescent population. Is we need to widen our vocabulary and our prevention messaging and wider than just talking about smoking and secondhand smoke. Because if you were to ask a child who was vaping if they smoked, they're going to tell you no. They may even tell you no if you ask them if they use an e-cigarette. If you ask them if they vape or ask them if they drool, because drooling has become its own verb, then you might get a response. So educating parents and teens and preteens about the whole variety of tobacco products that are on the market, that all of them are harmful, and having an idea what your kids call all of their tobacco use behaviors in your community is very often. And ask the kids and they'll tell you. The other resources you can have in knowing what's current in your community and your patterns of use is talk with your local school systems or your local substance use prevention group. And that'll give you a better idea of how to address the issue in language that is going to be understood by your patient population. In particular, it's so important to counter the messaging that is so prevalent in the wider world. You can't, remember, e-cigarettes are not regulated as strictly as cigarettes. So you have point of sale marketing, you have a lot of internet marketing, social media marketing that you can't do for regular cigarettes. And I ask you to pay attention the next time you pull into a gas station or convenience store and see how many advertisements for various tobacco products, both smoked, smokeless, and electronic, that you see. And all of these impressions that young people are bombarded with normalizes smoking behavior, reduces their risk, their perception of what their risk of harm is, and increases the chance that they are going to start using some tobacco products. My biggest point that I educate my parents with is that there's an adult conversation about tobacco use, in particular e-cigarettes, as far as whether e-cigarettes are safer or a harm reduction method, and whether or not they're safe for use, that they are never safe for use. And while e-cigarettes contain less of a lot of the harmful chemicals that are in regular cigarettes, they are not harmful. They contain very ultrafine particles that can be distributed very deep into the lung tissue. There's no long-term research on the effects of the different chemicals that are present in e-cigarettes, and there's a lot of research needed. So if you don't smoke or vape, don't start, and have an understanding of why. And the other point that I emphasize is that the modern e-cigarette products contain very large concentrations of nicotine, and it's a formulation of nicotine that goes down easy. It isn't harsh or uncomfortable like traditional cigarettes. So that, and these products that make it easy to ingest large quantities of nicotine to your system can get kids hooked really quickly, and that we have a lot of difficulty in having any evidence-based modalities to truly help kids quit. Other places I send kids and parents for help is there's American Lung Association, American Heart Association has some really good resources for how to talk to your child about vaping. American Lung in particular has a segment for educating parents on how to talk to their kids called the Vape Talk. So there's a variety of options out there to both educate your patient populations in prevention and to assist them with cessation.